The Office of the Public Protector says the hospital, which was built in 1974, lacks proper maintenance, and this is hampering and limiting the hospital from rendering proper and adequate services to the community. For more on the story, let's cross live now to our colleague Tumelo Machogo. Very good morning to you, Tumelo. What is the Public Protector's Office saying about this hospital?
Well, good morning, Desiree. The Public Protector did visit this hospital behind me last year on the 4th of September and subsequently released this report saying that this hospital is in a poor state, it's in a deplorable state, and also it cannot care for the people that are coming to this hospital. The visit by the Public Protector actually was to check if this hospital actually have COVID-19, is ready for COVID-19, to take care of COVID-19 patients, and they found that this hospital could not take care of COVID-19. They don't have ventilators in the hospital. The hospital doesn't have like a lot of space. Just in one maternity ward, the maternity ward has 2 beds that can deliver at the maternity ward, but only they only have 2 beds, but the hospital deliver 15 to 18 babies a day. So the hospital, that the patients don't have privacy when they have to deliver babies, or even patients don't have privacy when they have to consult with doctors, because doctors have to share a consulting room in this hospital because they don't have enough space in the hospital. But also they don't have enough beds. The hospital is big and it was built almost 30 years ago, and there's 40 years ago rather. But the hospital is still not big enough to take care for everyone, especially that are coming to this hospital, because it cares for a lot of people in this area and around this community of KaBokweni, not only KaBokweni, all the way towards Hazyview area, towards Mpumalanga, because it's one of the largest hospitals in the province. But also the Public Protector did find that the hospital cannot care for people here, and also they don't have enough doctors and nurses, and saying that they are lacking in space, in terms of like space to care for people that are coming in. They don't have enough equipment, especially ventilators, equipment to care for people that are coming here. Medicine was also one of the issues that they're still also faced with, the challenges of medicine, but also the fact that they don't have enough professional nurses, they don't have enough doctors to care for all the people that are coming to this hospital. So the Public Protector did say that the hospital, because it's also in a bad state, the laundry is not working, the x-rays are not working in this hospital. Now the Department of Public Works has to come in to start and rebuilding some of the hospital, the parts of the hospital that still need to be rebuilt, and also the fact that they need to get more equipment, they need to get more nurses and doctors so that they can help people that are coming to this hospital. Just today, it's one of the busiest days here in this hospital. It's Tuesday, so a lot of people are coming in to come and take medication. So it is a busy day for the hospital, but also that is a problem, because now people are queuing to go into the hospital to get assistance by the doctors, but also nurses, and that is a problem, because one nurse could be helping up to 100 people in a day, and also that is a problem for this hospital, especially but the maternity ward is the one issue that the Public Protector did say that it needs to be addressed as quick as possible, because it cannot be that the hospital has only 2 delivery beds, and then the hospital deliver 15 to 18 babies a day, and that is just a normal thing, because then there is no privacy for women who are coming in there to give birth, and there are no privacy for anyone who's also going to be in the maternity ward while these other women are giving birth. So the Public Protector did say that these issues need to be addressed as soon as possible, and then saying that the Public Works Department need to make sure that they address the issue of the building, and also the department need to make sure that they address the issue of the workers and the shortage of staff in this hospital. Desiree?
Tumelo, how far has the Department of Health in Mpumalanga gone in terms of improving the situation since the visit by the Public Protector? Have they responded?
Well, the department has not responded yet, but they are saying that they are trying to recruit more nurses and professional nurses in particular, and doctors to come to hospitals such as this one to ensure that they also assist the public. But also because of COVID-19, they're saying that they cannot hold interviews independent. They cannot hold interviews on a face-to-face basis. Now interviews have to be held virtually, so that's why they're saying that is delaying the process of hiring more people. But also, you remember that the province did have a moratorium where they're saying that they cannot hire more people into these public work, into these health facilities, and also into across the provincial across the province, because they don't have enough money to actually pay all of the people that they need to be hired. But the public protector did say that it needs to be addressed. There can't be like that. Nurses are being overworked. They're working over 70 hours sometimes without stopping. That they need to be assistants, and they need to hire more people to ensure that they reduce the burden that these nurses are faced with. But they're saying that they are still trying to attract more people, especially professional nurses and especially doctors to come to this hospital. But that has been a challenge for them to attract people that are professional nurses and also are doctors that they could come to this hospital. But also remember, it's a rural part of the province also, so those some people would not want to come to hospitals such as this one. But the public protector did say that issues of shortage of staff, that needs to be addressed. The issues of building, that needs to be addressed, and the issue of the issue of waiting and machinery that needs to be out there to help people, because this hospital can't help people who have COVID, who have to be on ventilators. This hospital cannot help those people, so the people here have to be transferred to other hospitals so they can get more assistance. So it means that if you cannot be helped here because they don't have a ventilator, you need to be transported almost 30 kilometers towards Mpumalanga, where you then will get another hospital to be assisted. That could also delay the helping those people, but also it could lead to death of people dying because they cannot get assistance in this hospital.
Tumelo, of course, for the public protector to investigate, there has to have been members of the community who lodged a complaint. Are we getting any responses from these people or from the general public in terms of how they feel about the level of decay in health facilities in Mpumalanga?
Well, the issue was actually brought by some of the workers and labor unions such as NAHAO. NAHAO has been very instrumental in saying that they need more assistance. We have seen protests, especially at the start of COVID-19. We've seen protests, especially in this hospital, where people are protesting, especially doctors and nurses, saying that they cannot be working in a hospital where they cannot help patients that are coming into them, especially with COVID-19. We saw in the beginning of COVID-19 when doctors and nurses in this hospital, over 99 of them actually tested positive for COVID-19, meaning that the hospital could not help more people that are coming into the hospital. So it means that those people have to go home and isolate, and that was a huge burden for the hospital. So that's why we've seen protests by the doctors and nurses, by the workers in this hospital, but also the communities that are coming to this hospital, they've also been raising concerns about issues that they cannot be helped on time. They come to hospital, you wake up at 4 o'clock, you come here, and then you sit at the waiting room to be assisted or to see a doctor or to see a nurse, but only going to see a doctor or a nurse in the afternoon because of a lot of queues that people are coming in. But also that has been the issue from the people that have been coming here, saying that they cannot be assisted on time. But and also the fact that the hospital sometimes is run out of water, that is an issue, especially in this hospital where the X-ray machine is not working, so people have to be transferred to other hospital where the hospital has run out of water sometimes for 2 weeks, and people who have patients or who have their loved ones in the hospital have to bring water from home so that their loved one could actually drink or take a bath if they have to take a bath, because the hospital sometimes do run out of water because it's in a rural area. But also the fact that the hospital doesn't have a lot of equipment like JoJo tanks to make sure that they store the water to actually help the people here. But the communities have been raising these concerns for years. There's saying that the hospital is not doing enough to help them, but they're saying that the hospital, because it's in this area, it's supposed to be helping the people who are living in this area. They cannot drive or pay transport to go to Mpumalanga to get to other hospital because it's closer to them, because even this hospital is caring for a lot of villages around the Ntsagazi area towards KaBokweni, towards Kanyamazane area. So a lot of people are coming to this hospital for assistance. So They're saying that they've been complaining for years, and now we are seeing that the hospital has started hiring. Actually, they have now a new acting CEO, a young person actually that they hired to make sure that they turn around the situation of this hospital, because it has been a long time. This is the community of KaBokweni, communities of this area have been complaining about the lack of services that they are getting from the hospital. So now the department has started with that. They have said that they will be hiring more nurses and more doctors to come to this hospital after they've seen the report. But also the public protector did say that they need to address the issue also of the building, because it's falling apart and it's going to be a danger to not only to the workers but to the patients that are coming to this hospital.
These are some of the issues that speak to how South Africans will be making their decisions whether to vote or not, and who to vote for in the upcoming local government elections. Tumelo Machogo, thank you so much for bringing us up to speed. A quick break as we chase the